Birth is often framed as something you prepare for and then move past. But for women, it's not just a single event. It's a transition that affects the body, the brain, and identity in ways that can last far beyond delivery. Today, I'm joined by Morgan Owens, a birth and postpartum doula, to talk about what support during birth and postpartum actually looks like and why so many women feel unprepared for what comes after. Hi, Morgan.
Hi, how are you? Thank you for having me here today.
Yes, I'm very excited to talk about this subject. So, for someone who may not fully understand, what does a birth and or postpartum doula actually do, and how is that different from the medical care women typically receive?
Yeah, absolutely. There are two roles here that we're kind of talking about today. Not every birth doula is a postpartum doula. Not every postpartum doula is a birth doula. So there are two separate certifications, two separate lines of work. Something that you mentioned that is crucial to this is that we are not medical professionals. We're never going to take your blood pressure. We're not going to give you medical advice. We're not going to check your cervix. We're not going to do any physical exams on baby postpartum, anything like that. We are there in terms of more of like a birth coach, or someone to support and guide you through the postpartum process, what we refer to as the fourth trimester. Birth doulas provide continuous physical, emotional advocacy type care while you're in labor and all the way through delivery, usually staying a couple hours post delivery. Postpartum care is more mom and baby care, physical recovery, emotional support. Usually that includes like a debrief on how the birth went, feeding support, education on how to take care of a baby. And it's a little bit more family focused. You will often see postpartum doulas provide care during the day or overnight shifts. And that type of care looks a little bit different as well. So daytime care is more focused on habits and routines. What does your home setup look like? How are we taking care of baby? Are you home alone? Do you have a support system with you? Overnight care is more focused to how much sleep can we help you get? Little things that we can do overnight, unload the dishwasher, keep some laundry moving, things like that. And then more focused on baby care. So when mom is sleeping, we're there tending to baby. She's logging multiple more hours than if she was tending to baby for the feeding and the change and putting them back down. And then there's a little bit of a handoff in the morning, and then we let you guys go, and then you spend the rest of the day by yourself. So lots of moving parts here, but basically mom baby care throughout, whether it's labor and delivery or postpartum.
Yeah, that sounds wonderful. And something that I feel like a lot of us maybe weren't aware was an option or a service. I know I had looked into some birth doula and postpartum doula, but then ended up having to have a C-section, and things unfortunately didn't work out the way I wanted. And speaking of that, a lot of women go into, I think, pregnancy and delivery with certain expectations, especially if it's your first time. But the reality is that it normally doesn't go the way that you expect. Why do you think there's such a disconnect between kind of what women think they're going to experience and then what they actually go through when it comes to, I guess, specifically delivery?
Yeah, I would say that there's three different paths to kind of answer this question. The first one is most of the time when you speak to someone who doesn't know what a birth doula is, their course of action tends to be, I'm just going to wing it. My body knows what to do. I'm just
Mm,
in there. The hospital staff is going to help me. I don't need to prep. Everything's going to be totally fine. The risk with that, or the con side of that, is that you're coming in unprepared for something that has a lot of different courses, right? Like you could have a super easy labor and your handling contractions really great and everything's totally fine. You're like, that was a breeze. You could hit some roadblocks. You could have a really long labor. And now all of a sudden you're crossing into territory where you're hearing a term for the first time. You're being offered an intervention that you're not really sure what that is. And you're learning about it 6 centimeters dilated in between your contractions, which are probably 2 to 3 minutes apart. That's not the time to be learning about Pitocin. So
right.
being prepared, not winging it, having tools in your toolbox and kind of knowing what to expect, even though it you may never need it. You may never need an intervention, but you also may need an intervention. And you don't want the first time that you're hearing about it or your research about it to be in the labor and delivery room. The second thing I'll touch on is if you are planning to birth in a hospital, which I would say all of the births that I've attended have been in a hospital. It's usually where people give birth these days. If you attend a birth course taught by the hospital, it is talked about in the doula community that they're teaching you how to give birth in their hospital, the interventions they're going to use, the timelines they're going to keep you on, what you probably will run into. And it is just very tailored into their ideal birth to get you in, have a baby, a doctor comes in for 2 seconds, does delivery, everything's good to go. Next mom comes in. And you can kind of feel like that. If that is the best option to learn about birth and the best resource available to you, 100% take that class. It is going to be helpful. It's often taught by nurses that are going to be there or work at the hospital, and it will provide you just so much more information. But don't stop there. Continue to do research on your own. Continue to find more things that you would like to how you want to feel during your birth, interventions that you'd like to stay away from, what those things mean, and just continue to kind of develop your general knowledge of all of those things, and you'll be in a better place. I think the third path there is people talk about a birth plan, and plans don't always
Right.
they usually don't happen the way that you plan. Whether you're planning to run a marathon or you're planning a road trip or you're planning to have a baby, you are prepared, first of all, so you have the right shoes, you have the right outfit, you know how you're going to fuel, you know where your aid stations are, you know how long your marathon's going to probably take you. But then the weather's different, or
Mm-hmm.
you blister, or you're chafing, or your fuel makes your stomach hurt, and now all of a sudden your plan is not working out. Birth is very similar to that. You want to know where you're going to be. You want to know who's going to be there. You want to know what snacks you're going to have, what clothes you're going to bring, what comfort for options you're going to have. But we're not going to lock into them. So they're going to be more like preferences instead of a birth plan. And I use that with my families that I work with quite often. When we are talking about how do you want to deal with pain management, what do you prefer to use? Is that water? Is it cold packs? Is it hot packs? Is it counter pressure? Is it a TENS unit? Okay, now we're pushing. What do you prefer when you push? Do you want to be on your back, on your hands and knees, or sideline? Do you want to labor down? We're throwing out all of these terms. One, they're learning what they need to learn. But two, we're talking about I prefer to labor or to push on my hands and knees, but when you get there, if that's not comfortable, we're going to pivot and we're going to do something else. If baby's in a position where that's just not going to feel the best, we're going to have you on your side, or we're going to have you in a lunge and do something totally different. So I think, one, not being prepared or not knowing what to expect. Two, kind of learning in a silo and just taking in information from one source. And then the third, being so locked into this is exactly how my birth is going to go and I'm not going to be able to pivot from this plan. Those can kind of deviate you from what you expect to have things happening the way that they're going to happen. So there is a go with the flow aspect of birth, and you kind of just got to see what cards you're dealt.
Yeah, I like that. I mean, those are all different kind of perspectives going into the process of delivery. But also, I like the touch on if you're just educated and at least you have the knowledge of, okay, I hadn't considered a C-section. I hadn't considered an episiotomy. I hadn't considered using Pitocin,
Yeah.
needing to be dilated. These aren't things that I thought about. I thought I was going to have a water birth or whatever. At least understanding what that means, what are the best options for you, and having someone there that's done this and
Yes.
can I think the main thing is advocate for you and for the baby, because there's also things they do with the baby afterwards that you have choices on. But again, if you're not aware and they're like, do you want this? Do you want this? We're going to do this. And you're like, I just delivered a child. I don't know.
Yep.
I remember I remember one of the things that was like startling for me. Not that I disagreed with what they were doing. It just, again, a C-section, heavily kind of out of it and drugged. And then after we realized she was okay, they kind of just like put her on me and put her on my boob. They were like, start breastfeeding. And I was like, I was so
Yeah.
I was like barely able to keep my eyes open. They were like, "Make sure you stay awake." And I'm st-
What's
I
happening?
it was such a crazy experience, and I know that some women have had way crazier experiences than that. So I want to shift a little bit to the postpartum aspect. What are some of the biggest gaps that you see when it comes to postpartum recovery, emotionally, physically, mentally? What are the things that you see?
Yeah, absolutely. Um, there's a couple big ticket items that immediately pop into my head postpartum. One is sleep. It is crucial for whatever type of delivery you had. You're in recovery mode. You just grew a baby for 9 months and delivered it either vaginally or a C-section. Both are huge events to happen to your body. So whatever happened, and sleep is crucial, right? It's going to keep your brain sharp. It's going to help your body recover. And having a plan for what your sleep is going to look like can make a huge difference. So there's a big gap that I see there. I say maybe fueling, food, easy things like that. If you are breastfeeding, you're likely going to be hungry all of the time. So when you're up at 3 a.m. feeding your baby and you are like, "Oh, I'm starving, but I can't move because I'm in the perfect position and we're comfortable and the light's not on, I don't want to get up." So having pre-planned snacks in your night drawer, like a little raccoon, and you're eating them in the middle of the night, but it's what you need. Um, and then shifting into feeding support, I would say is a big gap. Um, However you plan to feed your child is whatever works best for you and your family and you and your baby. But how can you successfully do that efficiently, safely? If you have a team or a support system, what does that look like? If it's you and your partner who's getting up in the middle of the night, are you switching back and forth? How much sleep is each person logging? Are you getting up every time together? If you're bottle feeding, how can you prepare those bottles before the night even begins? A lot of families who are using bottles, whether it's for breast milk or for formula, don't realize that they can prep them a day at a time. So you can have all of your bottles ready for 24 hours and then just grab them out of the fridge and heat it up. And at 2 a.m., that 10 minutes that you save is so important. So those are probably like physically the two biggest things that I see. Emotionally, I think is a little bit tied into the physical support. If you see a mom who is very physically supported and surrounded in a little bubble of care, you don't, at least in my personal experience, you don't tend to see a mom who's struggling emotionally. And
Mm.
she's not as stressed. She's not taking on these tolls of like, I'm sleep deprived, I haven't eaten, I haven't taken a shower, and also now I need to make a decision. I need to get my baby to the pediatrician. I have to figure out what I'm doing for A, B, and C, and I also haven't eaten myself in 12 hours. So when you support the physical side of it, I guess you allow a little bit more space for that emotional side to be whatever it's going to be. I'd love to do a birth debrief, whether I was there for the birth or not, and just give the mom time to talk about what happened. If it was super positive, let's talk about it. If it was not what you expected, let's talk about it. If it was horrible and you never want to do it again, that's the most important one to talk about. And you just create space for processing that. If there was a little bit of birth trauma going on, let's dissect it. Do you have questions? Do you wonder why things played out the way that they did? And a lot of that emotional processing, it just allows them to be like, wow, someone gets it who wasn't even there or like isn't my partner or my husband or my mom. And it's just, I have no emotional tie to it. So I just get to listen. I just get to help you process out loud what you went through. And that moment, you usually see moms just being like, thank you for letting me tell my story, because no one has really asked like how I'm doing. So I think just being there for the mom as well as for the baby is super important.
Yeah, I really love that. I didn't think about it that way, like the debrief part. That it's not just like, let me go over a list of what happened and what didn't happen and why I'm not satisfied. It can really be an emotional release. Like you may not even have known. Like I didn't know that I even had certain expectations that I was emotionally attached to, and then when that didn't happen, I had to grieve that.
Yep.
And that wasn't something that I talked about or observed for months later. But if I had somebody that had said, well, what did you want to happen? I might have been able to open up and acknowledge that a lot sooner. I also love the sleep plan or sleep schedule plan. I mean, as best as you can in the food prep. I know for my husband and I, we had made it. We're in a position where one of us can go into a whole separate part of the house,
Mhm.
a different floor, so that we could actually sleep. Because if I was going to be in the same room or and it was my turn off, I wasn't going to sleep.
Yep.
So
Yep.
having that like as a stated plan was a huge relief for me. So I love that you are saying, hey, it may not be perfect, but let's create a sleep plan. Let's get you some pre-cooked meals. Let's get you maybe some friends to bring some food over.
Oh yeah.
And all those things can really help, right? So that physical and emotional support. There is this bounce back culture, right? To snap back. You should, and not even just physically, but like you should be having all this energy and be ready to do all the things you're able to do before you had a baby. What's happening physically where that's not the reality of coming back from postpartum?
Yeah. I would love to start off by saying you would never go back. That the body you
True.
had before a baby,
Yeah,
she's gone. Like she's not coming back. It's just what do things look like now? When you are postpartum, you are postpartum forever. If you have had a baby,
that's right.
you never that doesn't go away. Whether you have multiple babies or one, you are postpartum. So it took 9 months to grow a baby, and your body changed, and things in your organs moved around, and your uterus expanded, and you grew another organ that you also birthed after your baby. So there's so much happening over 9 months. And then you have your baby, and maybe like a couple days later, you check in, and maybe like a 2 week check in and a 6 week check in with your doctor. And they're kind of like, all right, great. But it is way longer of a recovery process than just 6 weeks, and that 6 weeks mark is different for everyone. Maybe you've gotten like a physical check off of, okay, your bleeding is under control and your uterus is coming back down, but that doesn't happen overnight. That takes multiple months to get everything back into place. The hormone aspect of things, we're on the lookout for postpartum depression for 2 years basically.
Mm,
And it sometimes doesn't even hit you until you're 9 months or a year or 2 years in. You're like, why do I have no interest in anything or my baby, or I'm crabby, or I'm crying and I can't get it together? But I had my baby a year ago. Like, what's going on?
mhm.
So those fluctuations of hormones last much longer than we see the attentive care for mothers after a baby. Um, so don't don't let the bounce back culture for you. It is more of just what do things look like now, because you're not going back to that body. It is transformed into something new. A baby was born, a mother was born. We're not
Mm.
going back. So your physical things are going to be different. Your emotional needs are going to be different. You're now taking on a whole new role where you have to care for a child and keep it alive, and you want it to thrive and grow and be happy. And that's not something that your old body could do, but you were also born into be a mother, and now you have all of these new skills and all of these new like instincts that you didn't potentially knew that you had, and your mother ears are on in the middle of the night. You can hear your baby crying from like three houses
Mhm.
away. So give yourself grace, I guess, to the moms out there. Like, give yourself grace that this is a new phase, not how soon can I get back to where I was before this.
Yeah, like you said, not just a baby was born, but a mother was born. That's such a great way to put that. You're not supposed to be the old you. You have transformed to this really amazing process. Uh, what are some of the signs that something could be off, even if on the surface everything seems fine? Or you just, oh, I'm fine, I'm fine, I'm fine. Like what are some things you see?
And most moms will tell you, I'm fine. Oh, I
Yeah.
don't need any food. Oh, I'm really good. But then if you just push a little harder and say, well, I'm just going to drop off a casserole, and if it goes bad in your fridge, fine, they're going to eat it. If you offer to come over and do a load of laundry, hold the baby so she can take a shower. If you ask like, hey, should I come over? Do you need any help? No, we're good. We're good. But if you just say, I'm going to stop by at 4, is that good? Does that work for you? They're like, yeah, that would be great. So you can kind of pressure them a little bit, like yourself just a tiny bit, because as women, like we don't accept help naturally very well sometimes. Um, a couple things to look for with postpartum depression. It's different than baby blues in the way that baby blues is like 2 weeks, really intense, but you kind of recover. If you have a really stressful moment and you're crying, you're breaking down, but then someone comes in and they walk you through it, you can kind of get yourself back under control. If you put on a funny movie or you crack a joke, they're responding the same way as they were pre-baby. But if suddenly like something that constantly was making your partner or your friend laugh, and she's like, yeah, that's something to kind of watch out for. And that's something that's easy because you can kind of clock like, she's not quite like hitting that belly laugh that we used to. Like she used to love this movie. She would cackle the whole time. We're not really seeing that anymore. Not taking a shower, not eating, not staying hydrated, not really having an interest in baby, kind of just being like, yeah, they're good. We're doing just fine, but not jumping on baby when they're crying or not having that like instinct to run to them. Those can all be signs of something a little bit more intense than baby blues. And with the check-ins that you'll have, like with your normal one, you'll go see the pediatrician, you'll fill out the little form of like, do you have interest? How do you feel hopeless? And while that's helpful, they can kind of just scan it and move on. So having that form shared with your partner or shared with your parent or a sister or a friend and just say like, hey, these are some things I need my community to watch out for me because we're going to potentially deny it. We're going to say that we're fine. But that's when we need that system the most to kind of check ourselves. And then getting us in front of our doctor, in front of a therapist. Sometimes medication is the only way to kind of pull out of a postpartum depression state. It's not anything that's wrong, but you have just such a hormonal imbalance going on and can need some more severe correcting. So that's where your system is crucial because they're going to be watching those things. But yeah, those are some of the signs to look for.
Yeah, I would even add to like having done that questionnaire, uh, it didn't really for me touch on like postpartum anxiety, postpartum rage,
Yep.
and the questions they asked, I was like, no, these don't apply to me. But there were other things happening where I was like jolting awake every 5 seconds trying to sleep, worried about my daughter when she was perfectly fine
Mm-hmm.
with my husband. Those were signs of postpartum anxiety that I didn't clock.
Yep.
But if I had maybe more directed questions or had expressed that more to my support system, I would have caught that sooner.
Yep.
So but I'm so glad you've talked about some of the things like I think there's a lot of shame sometimes, especially maybe if you are feeling detached from your baby or you feel off, it almost isolates you even more because you don't want to tell anybody that. But I love that bringing that awareness, having the support system, kind of talking it out may highlight things for you that you didn't even know were off
Yeah.
or maybe felt some shame about. Um, Trying to think of what my next question was going to be. Oh, got it. If you were to give women kind of a practical mindset shift when it comes to birth or postpartum, what would it be, or both?
Yeah. To go back to your previous question for one quick second,
Yeah.
postpartum depression is also something to watch out for in your partner, dad, whoever
Mm.
that is. They can also experience postpartum depression in a different way, especially in men. It shows up a little bit differently, but it's not ever really talked about. And they go through a very intense situation watching the person they love the most go through something very intense, and they can't take their pain away. They can't make you more comfortable. They can just sit there and try to say the right thing and hold your hand and be supportive. But they watch this with this bird's eye view of you going through a really intense labor or you going through a C-section. And then sometimes they're put on the back burner with like, I don't really know what to talk about, or I experienced something that was really intense and now I'm kind of freaking out, or I don't know how to care for a baby and I don't know what to do, but I don't know where I should ask questions. So having a little plug for the dads or the partners out there too, like this is something that you can experience and don't feel ashamed to talk about it. It's like 14% of men feel this. It's definitely a higher than we thought it was, and more studies are coming out on it. So it's a whole it's a whole thing. Postpartum depression affects a lot of people, and it's very intense. Um,
Thank you for including that. Yeah, it's not something I considered. So yeah,
yeah,
great
it's
points there.
definitely newer on like the birthing world, but it's definitely something to be talked about and kind of raise a little bit more awareness too, because it's intense. Like, so I have been in the heat of the moment in a labor and delivery room with a mom, and I look up and dad is like deer in the headlights. I don't know.
Or passes out.
Whoa, oh my God, pass. I'm like, here's a chair. Would you like to sit? Let's move
Yeah,
the head and
but
lower.
it it makes sense though, because there's a feeling of helplessness. You can't do anything. You can't make it better.
Yep.
Your partner's now a new person, and you didn't go through that physical transformation or emotional transformation.
Yeah.
They went through it. There is this new being that's now probably taking more attention. And also, witnessing something traumatic is still trauma. It's definitely trauma.
Yep.
And almost maybe losing your partner, or and in some cases, if you have a stillborn, something like that, that's trauma. And that's a great point, that the dad, or the partner, I should say, may also still need to get help
Yep.
too.
Yep. So it's something to look out for everybody. With the question that you did ask,
Yeah.
my favorite piece of advice that has just stuck with me throughout my multiple years of being a doula, I was working alongside a very seasoned doula in Richmond, Virginia, and she took me under her wing, and we were doing some postpartum care together, some birth care together. And she said to a mom once, she was like, there are many ways to have a baby, and there are many,
Mm.
many ways to be a good parent. And I think just not minimizing your experience because maybe it wasn't the way that you wanted it, or it wasn't how someone else did it. There are so many paths that you can take to have your baby inside your body to outside of your body, and none of them are any less than any other experience. Whether you were unmedicated or whether you were medicated or whether you had a planned C-section or emergency C-section, I really don't love to say like, well, everything's fine, you have a healthy baby, because that's not true. The experience matters, but none of them rank you higher or lower than any other parent. You had a baby, and it's legit, and it was hard, and no matter what it was, it's serious, and you deserve a badge of honor. It was an amazing thing that was accomplished. Same with being a parent. With feeding, there's so much pressure that breastfeeding is best, or that is best, and all of these things that you can get sucked into on the internet that can really make you feel like you're failing as a parent. But if your child is healthy and they're growing and they're happy and they're smiling, you are doing a fantastic job. There are so many ways to show up as a parent. The most important part is showing up. So just continue to do that. Give yourself grace and allow yourself to be like, this was my experience, and it was maybe great, maybe not, but I'm not going to put any shame or guilt or attach anything to that. I'm just going to let it be what it was.
Yeah, that's a great way to approach that. I think we all need a little bit more of that in life in general.
Less doom
Uh,
scrolling, less comment reading, more of just,
yeah.
oh,
Yeah. And I think there's just like a level of, like you said, not minimizing acceptance, grace, love
mhm.
for yourself and what you went through. Um, Morgan, where can people find you if they want to work with you, or where can they find doula support if they can't work with you directly?
Yeah, a very quick Google search will help you find doulas in your area. There are a lot of resources, especially through certifications, that will certify doulas. So you can find I'm a DONA certified doula. So I have all of those certifications attached to my name. There's a couple other ones out there that are very creditable, very good options for you. I am on Instagram at mowensdoula, and then my Gmail is morganowensdoula@gmail.com. So those are the best two ways to reach me. I am a birth doula, a postpartum doula, and also a childbirth educator. So if you have questions or you want to just chat for an hour or to have a debrief of your birth, whatever you need. If you're like, we cannot figure out this bottle feeding, can you do a Zoom call with me? I can do whatever you guys need.
I love that. Well, make sure to check out Morgan. She obviously is very smart and has a lot of resources. And this has been really, really great. I hope a lot of women and men too, other partners, hear this and can get some more perspective on birth and postpartum. Yes, thanks again, and we'll see you guys in the next one.
Thank you.